Today we're going to talk about one of the most important things to me in dentistry that is often overlooked and people don't really discuss it. And when you're in a dental office, oftentimes there's just not the time available to go into the depth of how to do two things that are critical to oral care. One is how do you brush properly and how do you floss properly? Sounds easy. We've been doing it since we were small kids, but have we been doing it right and effectively? So that's what we're going to talk about today. A lot of people may have situations that look similar to this, and we're going to talk about how does this happen and how can you prevent it from happening in the future. So one of the key things is if you use a manual toothbrush, something like this that's not electronic, most people grab a hold of it like this. They almost get that tight-fisted grip on it where they're leaning into it, and the feel or belief is the harder that I scrub, the more effort I put into it, the cleaner the teeth are. And that's definitely not the case. Plaque itself barely is sitting on the tooth. So as long as the toothbrush bristles contact the plaque, the bacteria, it comes right off. So you don't want to go in there and lean in there and go to town and really scrub everything down. You actually just want to hold the toothbrush with the fingertips. That's it. So one of the keys is making sure the grip is correct, because when you do this and you have the fist type grip, it's way too much pressure on the teeth, and instead what happens as far as cleaning is you put too much pressure on the gums and the gums move away from the correct areas that they're supposed to be, and we call that gum recession. In this particular case here, the gum should be way up here, and they've actually dropped all the way down here just because of the trauma that we've done to ourselves trying to brush too hard. So the problem is that this tissue won't come back unless you have a surgical procedure. So our goal is to keep as much of this tissue here as possible so that you don't lose gums, which then in turn loses bone, and ultimately you could end up losing teeth. So we want to stop all that. So number one, the grip is critical, right? The other thing is nice, soft, circular strokes. So you actually want to take your toothbrush bristles, put them at a 45-degree angle towards the gum tissue like this. See how the bristles are going straight down in there? And it's nice, soft, circular strokes like this. And you get the bristles right up underneath the gum tissue, and then you just roll it up. So you do a nice circular motion, you roll it up because you're getting the bristles underneath the gingiva or the gums, and you're pushing that plaque right out of there. And so you're not doing it hard. Again, it's nice, soft, circular motions like this, and then you brush up, and then if you're on the top, you do the same movement, but you brush down, right, to get that plaque and bacteria out of there. Another thing that is often misunderstood is the toothbrush bristles and the firmness. So if you're using a medium or a firm toothbrush, those are for partials and dentures. Those are for things that you hold in your hand and you're scrubbing and you're going to town, and that's okay, but it's not meant for the mouth. So in the mouth, you want soft or even extra soft. So if you're used to a firm toothbrush or a medium toothbrush and you switch to a soft or extra soft, in the beginning it's going to feel like I'm just not cleaning my teeth because the bristles are so soft, and you're going to feel as though nothing's happening. But it is. It's about being thorough and getting in there and cleaning everything and making sure you're hitting every area, and the plaque will come right off. So don't think that the harder it is, the cleaner it is, because it's definitely not the case. Hard bristles, again, just causes gingival recession there, gum loss, and you definitely don't want that. Earlier we were talking about using a manual toothbrush. That's something like this that's not electric at all. If the best toothbrush that's out there, in our opinion, is definitely the Sonicare. There's many reasons for that. One is the Sonicare toothbrush is designed to do all the work for you. So when it's on, it actually moves a distance that covers the entire tooth. So it will move from here to here. Now, much like the manual toothbrush, you don't want to grip onto this thing and go to town either. It's the same concept where you're using it just like this, and you're doing nice, soft, circular strokes, and you're going up or down towards the gum line, and then you're swooping out that plaque and bacteria. So you don't want to put any pressure on there. So the beauty about this toothbrush, and it's Sonicare specifically, or a Sonic type toothbrush, is that the bacteria that lives underneath the gums that actually causes inflammation and it causes bone loss and these kind of things, it's called anaerobic bacteria. Now all that means is the bacteria that's under there, it doesn't like oxygen. Actually, oxygen kills that kind of bacteria. So the beauty about a Sonic type toothbrush And you can do this experiment at home. It's fun. You could take this toothbrush and you stick it in the water, and then you turn it on, and you'll just see an amazing amount of bubbles coming off of this thing. But what this is doing is that when you have this toothbrush at a 45-degree angle, you are forcing all those bubbles of oxygen underneath the gum line. So this toothbrush kills bacteria that it's not even touching. Unlike a manual toothbrush, you're not killing, but you're removing the bacteria, right? You're mechanically removing all the plaque and accumulation that's on the teeth. This is doing that, but in addition, it's flooding the gingiva with oxygen and killing the bacteria underneath. So that's pretty amazing. It's pretty exciting, right? Now, actually, as long as it's a Sonicare and has the sonic technology, it doesn't matter. So whether it's the $200 Sonicare that has a lot of the bells and whistles, connects to your phone and this kind of things, it's not doing any, it's not any more effective, shall I say, than the $30. So as long as it's a Sonicare, you're getting that benefit which we discussed, which is flooding that oxygen underneath the gum level and killing the bacteria. So it's personal preference, actually. Next topic, flossing. Flossing is critically important and something that most of us don't do, but may say that we do. And the other thing is a lot of us don't know how to do it and do it correctly. So when you floss, the first thing is the flossing isn't just getting between the teeth and hitting that contact point, meaning that, you know, you have some floss, you pop it through there. That's really not the point, because that's not what we're trying to do. We're actually trying to wrap the floss around the tooth, go all the way up to get the gum tissue, and then pull it back out. But it's a little bit different than just that. So we're trying to take plaque and bacteria that's in between the teeth, and we're trying to remove it. So for instance, a lot of people now are going to these little floss threaders. They look like this with a floss between there, and they go click, click, click between all the teeth. That actually doesn't help too much, because what you're doing is you're putting in the floss between the teeth, and then you're pulling it out and you're putting it in another area. So I'm taking the bacteria and plaque that's accumulated in one spot, and I'm just moving it to the next spot. So yeah, I might loosen up that plaque a little bit, and then if I swish really good and spit out, at least I've done something. But that's really not what we're looking for. One of the best things that you can possibly do is just get the floss that we've been using since, I don't even know, for a long time. Anyway, in my opinion, the best floss out there is Glide, and that's a personal opinion. And for me, the reason why I say that is I feel the plaque adheres to the floss much better with Glide than any other brand. So in my hand is not Glide, but I wanted to demonstrate and kind of talk about what is it that we're trying to achieve and how do you do that. So in order to floss correctly, you actually need a lot of floss. So if I'm going to floss all my upper teeth and my lower teeth, I need like this much floss. That's a lot. I don't need this much. I need like this much. So I'm going to go ahead and take this floss off here. The easiest thing to do is on your right finger, just get it a little bit like that. Now you can sit there and go all the way over here and just kind of wrap it all through here. You can do it this way, or you can just let it dangle. It's up to you, but you have to have a good grip on there. So the point is that when you go up in between the teeth, you're not just going up in between the teeth and popping it out. You're actually going up, and as you go up to the gum level and you're going down, you're moving it this way. So see, the floss initially goes up, you go up and down as you wrap the floss around the tooth in the shape of a C, but then you're pulling the floss away from the tooth the entire time. And what that's doing is that's letting plaque adhere to each portion. So every time you move that floss, it's actually a brand new piece of floss the entire time. That's why it takes so much floss to floss everything properly. And you got to make sure that you go around the tooth all the way up to the gum, to the base of that pocket as far as you can, and then keep going all the way down. And then you're not done, because if I'm going in this direction, I got the back side of the tooth in front. But now I got to get the front side of the tooth behind it. So then I got to go in there again, and then I put my fingers back a little bit, and I do the same technique, because if I have two teeth here, I got to make sure that I'm hitting this side, and I'm also hitting this side over here. So what I'm going to attempt to do is demonstrate how to floss without looking in the mirror. Me personally, I don't floss when I'm driving down the road because I can't do it effectively. So I like to look inside the mirror so I can make sure that I'm hitting all the areas that I'm trying to hit. So I'm going to pretend you're the mirror, and I'm going to go ahead and floss at least a few teeth so you can kind of get the concept. So like I said, little floss here, a lot of floss here. So I'm going to go up here and go hard and see how I turned it? Because you're going to do that the entire time. You can go to the next tooth. the entire time, all the way around, and get it nice and clean. It should take you a good 2 to 4 minutes to floss properly. In the beginning, it may take a little bit longer than that, but then you'll be able to whip through it pretty quickly after that. And then you'll be amazed on how clean your teeth are when you've flossed correctly. Not only that, the reduction in inflammation and the improvement in gingival health will be tremendous.